Hi, welcome to Wings for Life. This is the rise of Wings for Life in the fall of 2020. I'm Ann Edenfield-Sweet, the Executive Director and Founder of Wings, and we are glad you're with us tonight. As a reminder, we'd love to get selfies and pictures of you at home while you're watching us. So send them to either Facebook or you can text me. We'd love to see them. If you could, as a reminder, keep your video on. We want to see those pretty faces of yours. So when we're talking to you, especially when we get into the breakout rooms, we want to see your faces. And if you're doing anything private, just turn the video part off. Please mute yourself when you're not talking, but when we get in the breakout rooms, then unmute and everybody talk at the same time, because we want to hear and maximize that time. We want to hear what you have to say. Limit distractions, turn your cell phone on vibrate, get comfortable seats for your family members, and get something to eat and just enjoy the conversation. We've got a great speaker tonight. And if you've got any questions, write them in the Zoom chat area. And of course, if you haven't registered, we really encourage you to register with us. We need this registration for our grant purposes, to be able to tell people how many people have been listening. And so you could go into our registration site, and that is through the emails that I sent out. And then when we get into the breakout rooms at the very end, we want you to interact as much as possible. If you do lose internet service, this happened to one of our staff members last week, just log back in. And we'll try to keep an eye to make sure that if you got logged out at home for some reason, that we will get you back right into the meeting. Because we are going to be here. We are not going anywhere. Now, I'm so excited. We have a wonderful speaker with us today. Her name is Dawn Green. And actually, I've known her for a while. She was born and raised in Albuquerque. She attended Manzano and New Futures high schools. And then Dawn, at a very early age, at 6, was removed from her family and placed in foster care. And from the age of 18, she was in and out of prison. She was addicted to drugs, which happens to way too many people. Dawn eventually was able to turn her life around in a wonderful way. And now she has completed, it's called her Certified Peer Support Worker Certification, CPSW, for an abbreviation, certification, and she is currently working at Duke City Recovery Toolbox. When COVID-19 hit, she decided that she really wanted to work with OPRE, that's our Office of Peer Recovery and Engagement, and she is now working in an organization, a part of OPRE called Lifelink Training Institution, helping people that have been impacted by the pandemic, which really is all of us. But now she is doing that. She is very happy. She is mother of 6 children and living with her significant other, and has been sober for 32 months and is now doing great work and a contributing member, certainly a returning citizen coming back to help society. So I am so thrilled to have Dawn with us here. So Dawn, come and share with everybody and tell everybody about resources and strategies for coping with the crisis. Here we go.
Thank you, everybody. Thank you so much for having me here tonight. What an honor. What an honor to be able to stand in front of everybody and discuss the reality of what's happening in our world today, not just in our world, but in our homes. I was very, very honored when I was asked to come and speak here about what's happening with our children, and within our own homes, because it's something that's not talked about a lot. And for me, it hits very close to home because I have teenagers as well as grandchildren, and they don't always have the questions that we want them to ask, right? Because we don't always have the answers. So it's important for us to come together as a community and discuss things like this. And so, as we all know, this pandemic, it can be so stressful. There's so many questions that we don't have answers to. And some of these signals and these warning signs are, of course, it's fear. The fear of the unknown and the worrying because we don't know what's going to happen tomorrow. Of course, it comes with the health issues, the financial situations, loss of jobs, loss of homes, loss of vehicles, loss of pretty much everything today. Loss of your support services. One of the biggest things that I've seen during this pandemic is so many people that are relapsing and going back to drugs because they just don't know how to handle it. Changes in sleep and eating patterns. If you're starting to notice something that's different, that you're eating less or you're eating more, that you're not sleeping the way you used to, please reach out and get help, because there's help out there for everybody that needs it. We're not in isolation so much that there's not people that want to help, because we're here. I'm telling you firsthand, we're here to help. Worsening or chronic health problems. You know, they talk about if you have symptoms, if you have a fever, that you need to go and get checked. But if you're worried about it, please just go take the time and get tested, because so many people are asymptomatic and they come up positive, and before they know it, they've affected other people. So if it's something that's concerning you, please just take the time and go get tested, okay? Worsening of mental health conditions. I know for me, I suffer from mental health issues. And I started to notice my mental health deteriorate with some of the things that were happening, because just as everybody else, I was unsure of what tomorrow was going to bring. I had to seek out help. I had to seek help, and I had to get on the right medications that were going to help me so that I could become stable again and be that productive member of society. If you're starting to notice increased uses of tobacco or alcohol or any substances, please, please know that there is help out there. There are people here that want to help. And you're not alone, you know? Even though I can sit up here with a smile on my face because I see all of the positive things that are happening, it's still in my home. I still have to go home and I have to talk to my children about things that sometimes we don't feel comfortable talking about. So let's talk about helping children cope, okay? It's a reality that children and teens react to what they see from adults that are around them. So the more empowering you are within yourself, the more empowering you're going to be to those in your community and to those that are in your home. When parents and caregivers deal calmly and confidently, this provides the best support for their children. So please, be more reassuring to others and to your children, and be prepared. If your children ask you questions and you don't have the answers, it's okay. The last thing that we want to do is fabricate a story that's going to make them feel better, because the reality of life today is this is happening. This is happening, and the kids need to know that they have us no matter what, especially coming out of addiction, okay? Coming out of addiction, you know that it's hard when you come back home, that there's so much mistrust and so much just lack of trust. It's important that you stay stable for the kids, because they're going to be unsure and they're going to watch you through all of this. They're going to want to see how you react. So it's important that you stand strong and you stay empowered. The things to watch for your children and the behavior changes in them. This is really, really important, because sometimes it goes unnoticed, right? But these are warning signs that we have to look for in our children, because if this is happening, you need to get help. You need to seek help, you need to talk to your children, and just do whatever's necessary. Excessive crying or irritation in younger children. Yes, they're children, and yes, they cry, but if you start to notice that it becomes excessive, there's probably something happening. Returning behaviors that they have outgrown. If you have children that used to wet the bed and they stopped, and a couple years have gone by and they've started wetting the bed again, or they want a pacifier or a bottle, these are warning signs, and you need to take heed to them, okay? If there's excessive worry or sadness in children, that's not normal, right? Children are resilient. They're not supposed to worry or be sad outside of the normal realm of being children. But today in the life that we live, that is the reality of it. If there's poor school performance or they're avoiding school altogether, you need to pay attention. Please, please engage in the academics of your children. Please stay connected with their teachers. And communication, right? It's not always easy for all of us to be at home to monitor the children. And let's be real, like it's hard. It's hard for me to sit on a Zoom meeting for 2 hours a day because, I have something to do. And for a child, 7 years old, right? How hard is it for them to sit in front of a monitor? And then you think about the 16-year-old, the hormonal 16-year-old that has so much going on. Different kinds of peer pressures, right? Because now bullying and everything has come into our homes. It's no longer a thing of 8 to 3 o'clock and then your kids come home into the sanctuary where you live at and the bullying stops. Today we live in a cyber world, and with all the stresses that are happening, children they can be mean. And you have to monitor what your kids are doing on the internet, because that has a lot to do with the way that they react today. Avoidance in activities that they once enjoyed in the past. Of course, video games, all children love video games, right? But if they've stopped doing that so much and you have a yard that the kids can go and play in and all of a sudden they don't want to go out and play anymore, please pay attention to those warning signs. If they have unexplained headaches or body pains, there's something wrong with the kids, okay? Please, please pay attention to these symptoms. If kids are using alcohol or drugs in your home, I'm sure that you know. I know for me, I knew when one of my children decided to turn to addiction, I knew immediately that something was wrong. The behavior changed, the tone, the eyes, so many things changed, and all it takes is for us to pay attention, you know? So ways to support your children during this pandemic, okay? Talk to your children about the outbreak. Talk to them about what COVID-19 is doing and how it is affecting our world. Answer questions and share facts. Like I said, please don't share fabricated stories that you think your children just want to hear. Reassure your children, because we know, right? Things are going to get better. I have a motto that I live by, and it's, in the end, everything works out. And if it hasn't worked out, it's because it's not the end. Share how you deal with what you're going through, right? Talk to your kids about ways that you cope. If counseling is something that you've never thought about, maybe now's the time to think about it, because kids need that support. Limit family exposure to news coverage. Please be careful with what your children are watching on the television. Unfortunately, most of the things that are on TV today, it's negative. You know, I'm here to share some positive things tonight because we need to talk about the positive things that are happening in our society and not just the death toll or the numbers that have gone up, because the reality of it is, if we're staying as safe as we possibly can, we're doing everything in our power to prevent our families and ourselves from getting COVID. That's all that we can do, right? Try to keep up with regular routines. If you have to be at work and your kids have school at 8 o'clock and you've got to be at work at 6 o'clock, set alarms. Set up cameras in your home. That's probably one of the best things that you can do today when you're not present, because you have to go and earn a living to provide for your family. Set up cameras. Talk to your kids. Set alarms. Get them into healthy habits. Make sure that breakfast, lunch, and dinner are at the same time every day. Bedtime is the same. They get up in enough time to take a shower, to eat breakfast, and to be ready and prepared for the school day. Be a role model. More than anything in your household, being a role model is one of the best things that you can do. And please spend time with them. I know for me it's not always easy because I have a lot going on, but it's something that you have to do today. You have to make time for the kids, because before you know it, they're gone. They're up and out of the house, and they make their own decisions, yes, but we have an impact on everything. Support and guidance. I wanted to talk to you about the Lifelink Training Institute and what it's created for the COVID crisis. And today I can't really say that it's for those that are affected by it, because today everybody is affected by it. But you're not alone. I can't stress that enough. You are not alone. So the Lifelink Training Institute created a COVID crisis line, and if you're feeling anxious and overwhelmed and you just need some support, you just need somebody to talk to, you know. Not everybody has the best advice, but we all have really good ears to listen. That phone number, and please, if you get a chance, write it down. It's 505-954-1057. Again, that number is 505-954-1057. Lifelink Training Institute created this phone number, and it's 24 hours a day. There's somebody there that cares and that wants to hear what you're going through. And, you know, unfortunately, this pandemic doesn't discriminate, right? There's newborns that are being born with it, and there's elderly, mid-age people, teenagers, and it doesn't discriminate. So it's important that everybody knows that there's somebody out there that wants to help. If you need financial assistance, there's a website. It's called thecrg.abq.org. And it has every type of resource that you could think of. It's my go-to. It's up to date, and it has everything that you could think of, from the COVID crisis line that Lifelink created to help with housing, transportation, employment, pretty much everything. It's a great site. I wanted to tell you about the Diversion payment plan that, it's not talked about a lot. And I learned that the hard way going through TANF. When you're in need, right? You lose a job and you need some assistance just to pay the bills. And going to TANF, it can sometimes be humiliating. But if it's what you have to do, you have to do it. There's a grant. It's called the Diversion Payment Plan, and it's a grant through the TANF office. And it's a year of TANF benefits up front. So if you haven't received TANF benefits in the past year, and you don't plan on getting it for the next year, and you qualify for this, you can get a lump sum of 1 year of TANF up front. It's not just for anything. You have to show them evidence that you have a vehicle that's broken down, and if you get this vehicle fixed, you can then go back to work. Or you have bills that you're just a little bit behind on, but there's money out there to help people. And I want to share a little bit about what we've been doing with the Lifelink Training Institute. Like Ann had said, back in April, when all of this stuff started to happen, several of us in the peer support worker industry, we knew we had to do something. We knew that we had to be utilized because peer support work, yes, it's working with people and sharing your story on a very intimate basis about your recovery and how you got to where you're at. But at the same time, we struggle today, Everything is still happening around us. We're just learning to react differently. And so one of the ways that we react differently is instead of being selfish and looking, what we can do to satisfy ourselves, today we look for our community and what we can do to be a better part of it. Not something that I always have done. So we came together and, we went to Opry, we went to Militia, and several of us asked, what can we do? Please utilize us because so many people are going to be in need. We knew it was going to hit harder here at home. And next thing you know, we have this Hallmark project happening. And thank goodness that it started because we started to work with some of the people that had been affected and that were in quarantine and grants. And next thing you know, we're working with all these different counties because there's so many people. Not everybody's COVID positive, but everybody's affected by it in one way or another. And not everybody knows how to be in quarantine. Unless you've dealt with solitary confinement and incarceration, not everybody knows how to do that. So there's peers here that want to help, and it's not just for those that are in quarantine. We're here because we want to help everybody. We want to make this a better community because when this is all said and done, we're going to look back, right? And we're going to be able to say that we were pioneers in this. We had something to do with reaching out to these people that needed our help. And what a beautiful thing to be a part of and not ask for anything in return, just a smile. Militia over at Opry made a very, very good statement, and a very good suggestion. And she said that when all of this was over, that it would be a beautiful thing to have a huge summit so that all of these people that we talked to on the phone that have been affected by COVID and that we've been able to help, that we get to meet face to face, and be able to give these people a hug and talk to them and get to know them even more than we did, and for once, not talk about COVID. So I just, to share a little bit about myself, like Ann was saying, I was 6 years old when I was taken away from home, and I lived a life full of drugs. I went back home at the age of 12, and by the age of 14, I was pregnant. And didn't really know what to do. And by the time I was 18, I was a full-blown drug addict and a mother of 3. And when I look back on that, I think about the struggles that I had with drugs and being a teenage mother. And then I think about all the added stress today of what's happening and everything that I had dealt with back then, plus all of the unsureties that are happening in our world. And I just want to help people. I want to help people the way that somebody helped me when I needed it. I want somebody to know that I believe in them. And there's so many of us that are working with the Lifelink Training Institute today. That's all we want to do. We just want to help. We want people to know that they're not alone. And please write that phone number down and know that there's people that want to help you. It's 24 hours a day. I'm going to give you that phone number again. It's 505-954-1057. It's the Lifelink Training Institute COVID Crisis Counseling. If you need any more information, please get in touch with Ann, and she can reach out to us, or you can look up the Lifelink Training Institute. I want to talk about everybody that's come forward to help us. God's Warehouse, they donated food to a lot of the people so they had a warm meal. First Nations, they've come forward and started helping people with housing vouchers. That's been a beautiful thing. You know, I've had several of my clients be able to get help with housing, and hanging up the phone and knowing that somebody's going to have a warm place to sleep, you know, until they decide not to. It's a wonderful thing to be a part of, and I'm very, very grateful that I've been chosen. You know, my higher power chose me to do this today, and I'm going to do it to the best of my ability. The same way that I did it in my addiction, and I went full-fledged, committed to my addiction, right? I'm doing that for my recovery today, and I'm doing that for my community today. I'm doing that for my children. I'm doing that for my significant other. I'm doing that for my family, and I'm doing that for those that are around me, because that's what we're supposed to do, right? It's the human thing to do and the decent thing to do. I want to thank everybody for giving me this opportunity. Thank you so much. And that's it. I'm done, guys. Thank you so much. Please write that number down, okay? 505-954-1057. Thank you.
Wow. Well, thank you, Dawn. That was wonderful. I knew it was going to be great. And I hope that people will make a call to that phone number, because there are people that can help. Wings can help. And of course, if you're on this call, you're somehow connected to us, and so you know how to reach us. But you can always call us. I answer a phone, my cell phone, 24/7, 365. This is truly a ministry. This is not just an 8 to 5 job. So there are people that care, and the important thing is that you all know that there are people that care. Well, I always like to close with a story. And I, during COVID, started sending out positive stories, because I thought that might be a way that I could get into the homes of people that I couldn't be reaching otherwise. This is the very first story that I sent out. And it's called Pandemic by Lynn Unger. And she wrote it as soon as COVID started happening. And I thought it was such a perfect opportunity today to be able to share that, and in light of what Dawn was going to share. So here it is, Pandemic. What if you thought of it as the Sabbath, the most sacred of times? Cease from travel, cease from buying and selling, give up just for now on trying to make the world different than it is. Instead, sing, pray, touch only those to whom you can commit your life. Center down. And when your body has become still, reach out with your heart. Know that we are connected in ways that are terrifying and beautiful. You could hardly deny that now. Know that our lives are in one another's hands. Surely that has become clear. Do not reach out with your hands, but reach out with your heart. Reach out with your words. Reach out with all the tendrils of compassion that move invisibly where we cannot touch. Promise the world your love, for better or for worse, in sickness and in health, so long as we all shall live. Thanks for joining us tonight at Wings for Life. We'll be back next week. Sure hope you'll be joining us. Thanks so much. Have a blessed night.